Providence Center for Advanced Heart Disease, your certified center for ventricular assist device therapy.
How hard are you working here?
Oh, I'd say 9.
For 10 years, Les Heasley has been dealing with heart failure, but a year ago, things took a turn for the worse.
I started going downhill pretty rapidly. From that point, they would bring me into the hospital. I was probably in the hospital, 9 or 10 times last year.
Heart failure is a condition in which the heart muscle becomes weakened through a variety of diseases, and that can include coronary artery disease or heart attack. And in many cases, we don't know exactly why the heart muscle is weak. But when that happens, people can experience a myriad of symptoms, including shortness of breath, fatigue, general lack of energy, dizziness, palpitations.
Slowly forward, slowly back.
Like Les, Joe Hansen has also been diagnosed with severe heart failure, but they now have a new lease on life thanks to an implanted heart pump called a ventricular assist device, or V.A.D. Here's how a V.A.D works.
The left ventricular assist device is a surgically implanted heart pump. One end of the device goes into the heart directly to unload and draw blood out of the heart itself, and then the pump pumps the blood into the aorta, the main blood vessel emerging from the heart. Providence is very excited to be able to offer this groundbreaking technology as one of the few centers in the entire state of Oregon and in the Northwest to provide this service as destination therapy.
For some patients, a V.A.D may be used as a temporary therapy while they wait for a heart transplant. But for patients like Les and Joe, who aren't candidates for transplantation, a V.A.D has been approved as destination therapy. In other words, a permanent solution.
The device is powered by electrical power, and it does require that a drive line be tunneled under the skin and exit near the abdomen. And that drive line is then connected to a system controller that the patient wears, similar to a beeper, on their belt. And they require a constant source of power, either batteries that are worn on the shoulders, or when they're at home, they can actually connect to wall power.
While an assist device isn't the solution for everyone, Les Heasley knew it was the right decision for him.
My wife and I would like to spend a lot more years together, and without this, that would not have happened. I would probably, I'm in all candor, I think I would be dead right now.
Just a few months ago, Joe Hansen couldn't walk more than a few feet at a time. Now he's tackling tough tasks in stride.
Cardiac rehab has been just terrific. I enjoy participating in cardiac rehab. It makes me feel good, just to do all the exercises. And as a result, I think I'm gaining strength and improving my coordination. I just enjoy it a lot, and I think it's helping me quite a bit.
Once they recover from the surgery, they're able to do things that they hadn't been able to do for years. For example, they can resume shopping. Some patients resume golf or other activities. Many of the patients are able to do rehab and walk on a treadmill, so it's really life-changing.
I'm hoping that by May I can go out and golf with my son again, because I haven't been able to do that in a year, and that's important to me.
It's given us hope, because the diagnosis was that he was not, his prognosis was very, very poor. He was not going to live much longer. And now we're thinking, maybe 10 years, maybe 15 years. And in 4 years, we have our 50th anniversary coming, and we want to have a big party. Have all the kids and friends and all to celebrate with us that we got this extra time.
If you have questions or concerns about your heart health, please consult your primary care physician. To inquire about ventricular assist device therapy or to refer patients for assessment, please call Providence Center for Advanced Heart Disease at 503-216-1182.